Word on Health, the report with its finger on the pulse of popular medicine, with Paul Pennington. Word on Health, for your very best of health. A report by early years charity Kindred found that during term time, school staff are diverting 2.5 hours a day on average away from teaching and towards supporting children who are not school ready, with 1 in 4 children starting school not toilet trained. The report also found that only 50% of parents think that they're solely responsible for toilet training their child, while 1 in 5 parents surveyed wrongly thought that their children don't need to be toilet trained before starting reception. Juliette Rayner from E.R.I.C, the children's bowel and bladder charity, outlines when parents should be toilet training their children.
When a child can sit up, that's the time to start really thinking about it. So even just sitting the child on the potty, fully clothed, maybe with a toy or a book, so they're relaxed about the potty. So when they're a bit older and you start to think about taking the nappy off for a little bit, they're used to sitting on a potty, and the optimum age for children to be toilet trained is between 18 months and 24 months. Now that is not right for all children, and equally we know children who've got perhaps an additional need, they will take longer and it might not be appropriate, so we can start them that early. There's lots of other things going on. But as a ballpark figure, we'd say 18 to 24 months. And if you haven't started by then, you really should.
I know there's a whole host of reasons that may contribute to why children don't get trained in the timescale you've mentioned. Recognising the problem, E.R.I.C has launched a multifaceted campaign via your website to help and support parents get ahead of their children's start at school by helping them toilet train their kids if they haven't already done so.
We have got lots of different tips and advice. So if you have got a child that will only poo in a nappy, there's lots of information on our website about how you change that. There are tips on good bladder and bowel health, making sure children are drinking enough. There's a bit of a myth that drinking is more likely to let children have an accident, but actually drinking more helps a child's bladder to expand and get stronger. If for some reason they're still not toilet trained by the time they start school, we hope that the parents will have enough awareness to know that they can talk to the school about what the specific issue is, so that there's a better relationship between school and the parents.
Can late toilet training hide continence issues?
Yes. Constipation is a very, very common condition in children. 1 in 3 children will struggle with constipation at some point, and 1 in 2 children with an additional need or disability. And often it doesn't really get noticed. These are the kind of things that you just want to identify as soon as possible.
Alongside the emergency intervention you've launched to help parents toilet train young children, I'm conscious of the other work E.R.I.C does through your campaigning and the support your helpline advisors provide for children of all ages and their parents. How wide-scale are continence problems in children?
Well, we know that 1 in 12 children struggle with a continence condition. What we need to keep in mind is some of these conditions people don't like to talk about or they don't get help for. So actually that is very likely to be quite a significant underestimation of the real scale of the issue. Bedwetting is something that some families don't want to discuss it with anybody, not even their GP. They think hopefully the children will grow out of it. And many children do grow out of it, but they've gone through years of discomfort and struggling, really not being able to go on sleepovers and school camps and things, but they don't because they don't want anybody to know about their condition. Constipation is not something that we all talk about, but actually that is a continence condition in its own right and can cause lots of problems going forward. So what our responsibility is as parents is to help children enjoy good bladder and bowel health, making sure they're drinking the right quantities for their age. And we've got charts on our website that say how much children of certain ages should be drinking. Children have a healthy diet, that they get enough fibre in their diet, making sure that poo is healthy, consistency. And again, we've got a poo checker on our website so you can see the different types, that the parents are familiar with the colour of their wee, the shade of their wee. As long as a parent is doing all of that, they should be able to identify when something's not quite right. And if they know there's something not quite right, depending on the age of the child, you talk to your health visitor or school nurse or go to the GP and get a medical opinion.
My grateful thanks to Juliette Rayner. To access the E.R.I.C website, to reach the resources, help and support the charity provides, visit our website, wordonhealth.com. That's wordonhealth.com. Word on Health, for your very best of health. Tragically, every week across the UK, at least 12 young people die of undiagnosed heart conditions. The charity Cardiac Risk in the Young has, thanks to the generosity of the British public, been working tirelessly for the past 30 years to reduce the frequency of young, sudden cardiac deaths, raising awareness, funding research, supporting affected families, and providing cardiac screening to young people. Their CEO is Dr. Steven Cox.
Sometimes there are symptoms like exercise-related chest pain, palpitation, dizziness, breathlessness, but these are either quite easily dismissed for other reasons or they don't exist at all. And in 80% of young sudden deaths, there are no symptoms whatsoever. So the first time this happens is a sudden collapse. Sometimes the death can be prevented, but so often that is just not possible.
Stephen, we may get the impression that these hidden cardiac conditions manifest themselves in young people whilst they're in the throes of physical activity, but I understand that's not the case.
The vast majority of young sudden deaths occur at rest or even during sleep, where certain procedures we would have are not going to be relevant.
As I touched upon in my introduction, your organisation, E.R.I.C, offers subsidised ECG and echocardiogram screening to all young people between the ages of 14 and 35 across the UK. How successful has that been in detecting problems?
1 in 300 people we test routinely will be identified with a cardiac condition, which could be potentially life-threatening. 1 in 100 people we screen will be identified with a condition which may not be immediately life-threatening, but will actually prevent them presenting in a cardiology ward in their 40s or their 50s when they're breathless, at a time when the condition is much harder to manage and treat. So it's really important to identify conditions early so that we can manage them, we can monitor them, and we can give that lifestyle advice to help them live the best quality of life possible.
If you are found to have a problem and are, say, a keen young athlete or footballer, does that mean an end to all that?
Some of the most important research we did with elite footballers showed that 75% were able to return to their professional sport having been identified with a condition, having received management advice to reduce their risk of having any cardiac arrest. So it's really important that people know they have the condition, and usually they will be able to continue their life completely as normal, but sometimes they will have to make lifestyle choices.
And finally, Stephen, what advice would you offer concerned parents, carers and young people themselves?
Every fit and healthy young person from the age of 14 up should be aware of the screening service that we offer, and they should take that opportunity to register an interest on our website, testmyheart.org.uk. We will be getting to your community to be able to offer that screening, and there's much we can do once a condition is identified to reduce the chance of something going terribly wrong.
My grateful thanks to Dr. Steven Cox. To find out more about sudden cardiac death in the young and to link through to the E.R.I.C website to sign up for their screening programme, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health, your personal prescription for your very best of health.
Group B streptococcus, also known as Group B strep, GBS or Strep B, is the most common cause of life-threatening infection in newborn babies. Untreated, it can kill a newborn within hours. It's thought around 1 in 5 pregnant women carry Group B strep, in many instances without knowing it. Whilst most women who do carry it go on to have healthy babies, on average in the UK and Republic of Ireland, every month 66 babies are diagnosed with Group B strep infection, comprising of 40 early onset and 20 late onset infections. Most, thankfully, recover fully, but sadly, 1 baby each week dies from an infection and 1 baby each week recovers with a life-changing disability. Since 2006, Jane Plumb and her family have dedicated their lives to eradicate Group B strep infection in babies through their charity Group B Strep Support.
The most common infections it causes are sepsis, pneumonia and meningitis. Most babies who develop early onset Group B strep infection show symptoms within the first 12 hours of life, so it's very likely that infections will be picked up while the baby is still in hospital. Having said that, the most common symptoms of an early onset Group B strep infection is the baby making a grunting sound, the baby not feeding well, the baby being abnormally drowsy, lethargic, sometimes they're irritable, and sometimes their temperature is either high or low. Those are the most common signs, and the important thing to know about Group B strep is that most Group B strep infections in newborn babies can be prevented.
In addition to early onset Group B strep infections that you were just talking about that does manifest itself quickly after birth, there is also late onset GBS that can develop 7 or more days after delivery and isn't normally associated with pregnancy. Most developed countries offer all pregnant women a GBS test late in pregnancy and then offer antibiotics in labour when the test result is positive. And that's helped make significant drops in the rates of GBS infection in those countries. But I understand the UK doesn't do this.
In the UK, there are some hospitals that will offer tests for Group B strep, particularly when a woman asks to be tested, but there are also maternity units that won't. The NHS uses what they call a risk-based strategy, whereby they look for certain characteristics during pregnancy, labour and delivery, and the risk factors that they use is if mum has previously had a baby with a Group B strep infection, if Group B strep has been detected in any way from mum during the current pregnancies, or if she has a fever in labour or other signs of a chorioamnionitis infection during labour.
I know from talking to you off microphone that training for new maternity staff in Group B strep is now mandatory, with your organisation introducing a free online e-learning module. There's talk of a vaccine being developed in the next 5 years, and the results from a study into testing across the NHS are expected in 2025. If pregnant women want the test for Group B strep, if it's not being offered by the NHS locally, and look to access it privately, what should they bear in mind?
The standard non-specific tests for Group B strep, whilst they are hugely accurate when they find Group B strep, they will miss up to 40% of women who are carrying Group B strep. If you're pregnant and you want to be tested and you want to know that you're accessing the gold standard ECM test for Group B strep carriage, then we list on our website and can put you in touch with organisations that offer that gold standard test.
My grateful thanks to Jane Plumb. To find out more and to access the Group B strep support website, log on to ours, wordonhealth.com. That's wordonhealth.com.
Word on Health, for your very best of health.
Rheumatoid arthritis is a long-term condition that causes pain, swelling and stiffness and impacts 1% of adults across the UK. Research shows that publicly it's poorly understood. Claire Jacklin, CEO of the National Rheumatoid Arthritis Society, explains why.
Because of the word arthritis in the title, people think, oh, it's just a few achy joints, and it's nothing to do with ageing. Anybody over the age of 16 can develop rheumatoid arthritis.
So, Claire, what exactly is rheumatoid arthritis?
An autoimmune disease. It's where the immune system starts attacking the lining in between the joints for many different reasons. There's no one reason why it triggers. And being an autoimmune condition, it doesn't just affect the joints. It can affect the eyes, it can affect the lungs, and it can also affect the heart.
And who's at risk of developing it?
It does affect 3 times as many women as men. Many women develop RA after pregnancy or going through the menopause. Certainly puts you at a higher risk if there is a family history link, and stress also is a key trigger for all sorts of long-term conditions. Very few people realise that smoking can actually trigger your immune system and can cause inflammatory arthritis. If you've got a family history of any autoimmune condition and then you smoke, you're doubling your chances of developing rheumatoid arthritis. If you continue to smoke once you're diagnosed, it can reduce the efficacy of the treatment by up to half.
I have read that it can, on too many occasions, take time for rheumatoid arthritis to be diagnosed. Your organisation has campaigned long and hard to highlight the importance of early detection. What are the signs and symptoms?
Early morning stiffness that lasts for probably more than an hour. Whereas with osteoarthritis, the stiffness and the pain tends to come with the more you've moved. Hot, swollen joints. And when I say hot, you could actually put your hand over the joint and you can feel the heat radiating from it. And quite squishy to touch and feel. And also overwhelming fatigue. Lots of people talk about this kind of brain fog. You just can't even formulate words clearly and you feel really run down. Sometimes a little bit feverish, flu-y-like, and of course the stiffness and pain in the joint. People sometimes feel that their fingers are almost frozen in a position. They really have to work hard to get the fingers moving or get the toes moving or the elbows or shoulders
Once you've been diagnosed, what does treatment look like for people living with rheumatoid arthritis?
Treatment has come on leaps and bounds over the past 20 years. We have very targeted therapies now. Certainly with the treatments that are available now, people can live really full, productive, healthy lives. It isn't just about the medicines, though. Exercise and diet play a key part, and also self-management techniques, learning more about the condition so you're more in control. So it's not just up to the clinical interventions, it's around the holistic approach to treatment.
My grateful thanks to Claire Jacklin. To learn more about rheumatoid arthritis and link through to the charity for further help and support, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health, for your very best of health.
As someone who's lived through difficulties, I know how hard it can be when things are overwhelming to be able to talk about it. One charitable organisation dedicated to providing a free, anonymous and non-judgmental listening ear are the Samaritans. Matt Williams has volunteered his time to the charity for over 10 years.
Samaritans are about 22,000 ordinary people doing something extraordinary, providing a listening service to anybody who needs it. We've got a free to call number, which is 116 123. We offer time and space. What you say on the phone to a Samaritans volunteer stays between you and the volunteer, unless there's some sort of immediate danger or somebody's at risk of abuse. We have no agenda. We're not preaching. We're not telling people what to do. We're just allowing them to be themselves and being alongside that person.
What training do Samaritans volunteers receive?
It's suitably rigorous. It's quite intensive. People phone that number in all sorts of stress and states and all sorts of stories in their lives. So it lets you know how to speak with somebody who is deeply upset and giving you the confidence to do that.
The Samaritans are encouraging people to talk to us. What's the thinking behind this awareness push?
The sad reality is that a lot of people are carrying around with them an awful lot of sadness, of grief, of desperation. It might be about things that have happened in the past. It could be about mental health issues. It could be about schools. It could be about exams, joblessness, all of these things. And it gets heavier and heavier and heavier. And what we're saying is, talk to us. We're not going to wave a magic wand to make it better, but by talking, you can be heard and you can find your own way with the support of a listening volunteer. Whether you're young or old, male or female, gay or straight, black or white, it doesn't matter. Samaritans is there to provide a service for everyone, whatever they're going through. If it's causing them problems, difficulties, then we will listen to them.
Hearing what someone says is one thing, but actively listening is something completely different. And I know the Samaritans are passing on pointers on how we can be better listeners, which you've encapsulated in the acronym SHUSH.
It starts off with show you care. When you're talking to somebody, it's really important. If you're going to embark on a conversation, you've noticed somebody is not themselves, then it's important to show that you care. And that means that you've got 20 minutes, half an hour, however long it is, available for that person. Your laptop goes down, your phone goes off, and you look at them and you genuinely show you care. The H is having patience. Patience isn't easy. Sometimes it's very difficult when someone's opening up for the first time. They're hesitant. They don't know what to say or how to say it, and they're finding the words. Actually, it can be a very stop-start process. So having patience and waiting for that person to open up. Using open questions, not something where you're going to say yes or no. And the second S is say it back to that person. So you're trying to build rapport with that person. You're trying to be alongside them, using the words, maybe the tone, the rhythm of their speech, and sometimes to check. So somebody says, I don't want to be here anymore. That can mean a huge number of things. It could be that they don't want to be in this conversation. They want to be abroad on holiday. Sometimes it means that they want to end their own lives or what have you. So actually by asking, when you say you don't want to be here anymore, I wonder what you mean by that. You actually find out what that person needs and without assuming. And the final H is probably my favourite of the SHUSH acronym, which is have courage. Courage to ask a difficult question, the courage to hear and acknowledge a difficult answer, and the courage to then respond with kindness, without judgment, and to really be kind to that person. Because this isn't easy. Starting a conversation with someone you worry about is difficult. And SHUSH, of course, is helpful in itself because the key item in the Samaritans toolbox is silence. Allowing a comfortable silence between you and the person you're speaking with, allowing that person time and space to find their own words.
My grateful thanks to Matt Williams. That free phone number to reach the Samaritans is 116 123. That's 116 123. You can also find out more and connect through to the charity through our website, wordonhealth.com. That's wordonhealth.com. keeping you in touch with the health and lifestyle issues that matter. This is Word on Health with Paul Pennington.